the first thing we want to do when we're looking at low back pain and sciatica is we want to find out about your pain. And basically what we're trying to do is we're trying to find out if that pain is reproducible, okay? Reproducible. So what does that mean? Basically, we're trying to figure out what sort of things that you do increase your pain or cause your pain. So give me some examples. Go ahead and throw them out. I'm going to write them up here on the board. Yes. Sitting. Good. Standing. Keep them coming. Jogging. Good. Walking. Bending. Lifting. I'm going to put carrying with that too. Carrying, bending, walking, sitting, standing, anything else? Yes, transferring, basically sit to stand. Yes, also out of bed in the morning. Okay, what else? Vacuuming is a very common one. Vacuum. Okay. So those ones are pretty common, and every time I do a workshop like this, that's pretty much the list that we get. The good thing about this is that if we can determine what causes your pain, so what reproduces your pain, we know that pain now is reducible. Okay. If we can reproduce your pain, or if you know what causes your pain, then we know it's caused by some sort of mechanical problem, okay? Mechanical problems we can fix. We can help you with that. You would then fall in that 90% that I talked about that is typically successful with our brand of physical therapy. If for some reason, no matter what you do, you're always in constant pain, 4 or 5 out of 10 pain, doesn't increase, doesn't decrease, no matter what you do or what position you get in, then you're probably in that 10% range that we have trouble fixing, and we need to get you off to somebody that can help you and move you on. So if that's the case with you, please stick around afterwards and let's talk for a minute and figure out what we can do for you and who we can get you to see so that we can get you some help. But really, I think most of you kind of shouted out 1 or 2 of these things. So we know that your pain is reproducible, which means that it's reducible and we can help you, okay? So, yeah, exactly, yeah. So if you have pain with walking or in the grocery store like that, then that's usually mechanical. It goes away when you sit, you said earlier. So that's a mechanical type pain that even though there's maybe that dull ache for 5-10 minutes after you sit down, it goes away, so it's reducible. So you're not in that category that it's constant, even though you get a little bit of ache after the activity or for a little while after the activity. It increases and decreases depending on what you're doing or what posture you're in. So that's what we're looking for when you first come into any good physical therapist, is going to ask you these questions. What's going on? When does it hurt? When does it go away? What makes it worse? What makes it better type thing.